Welcome to the Empowering Health Consumers with Disabilities information video. This video will discuss medical records, information sharing, and informed consent within the WA public health system. Medical records are the medical information records any health service keeps. These can include your medical history, your care or treatments received, test results, diagnoses, and medications taken. Services have a responsibility to store and keep your records private. Medical records include both clinical information as well as observations. They should be factual and non-judgmental. If a medical record is wrong, you can apply for a notation to be added. You have the right to request access to your records for health services, and this may cost a small fee. My Health Record is an online record system the Commonwealth has created for every Australian. If you did not opt out, there is a record for you. The information uploaded is dependent on the health services, but often includes hospital discharge summaries, GP notes, pharmacy scripts, and sometimes scans and blood test results. Past medical records are not uploaded unless you have requested My Health Record to do this. You can upload your Advance Care Directive directly. You also have the option to hide some of the information from view of any staff that access your record. Consent is very serious and important for doctors, health staff, and for us. Under WA policy, there are 6 steps to ensure consent is given. This includes an assessment of the patient's capacity, providing enough information such that the patient makes an informed decision, and verifying the patient has answered all the questions and has understood all the information. More information can be found in the WA Health Consent to Treatment Policy. All adults should be assumed to have capacity to give consent, and this will be assessed by the health professional. Children can also be assumed to have capacity as they get older and might be called mature minors. There is no determined age for this, but it is often around 13 years old. Capacity is also decision-specific. This means some people might be fine to make decisions about more simple treatments, but may need help with more complex treatments. If a patient has low English proficiency or special needs, the service is required to engage a translation or interpreting service. The health service cannot rely on family or friends. Consent given is valid until we withdraw, or circumstances change such that what we agree to do is no longer appropriate. Health staff also need to ask you before treatment is actually undertaken to confirm you still consent. They need to ensure you understand what is going to happen, and they must record that. If you are unable to make decisions, there is a hierarchy of decision makers the healthcare provider will follow. This begins with an Advance Health Directive. Second is the enduring guardian with authority. Third is guardian with authority. Fourth is a spouse or de facto. Fifth is an adult son or daughter. Sixth is a parent. Seventh is a sibling. Eighth is a primary unpaid caregiver. Ninth is another person with close personal relationship. Within an advanced care directive, you can nominate a person to make decisions on the care you receive and specify the medical treatment and care you would like to receive when you are unable to make decisions.